Acetadote is an antidote for acetaminophen overdose, indicated to prevent or lessen hepatic injury after ingestion of potentially hepatotoxic quantity of acetaminophen in patients with an acute ingestion or from repeated supratherapeutic ingestion. Dosage and administration. Recommended dosage in adults and pediatric for acute acetaminophen ingestion. Acetadote is for intravenous administration only. Dosage regimen. The total recommended dosage of acetaminophen is 300 mg per kilogram, given intravenously as 3 separate sequential doses. Free-bag method to administer the loading second and third doses. The total recommended infusion time for 3 doses is 21 hours. For the recommended weight-based dosage and weight-based dilution in patients who weigh 5 to 20 kg, see Table 2, 21 to 40 kg, see Table 3, 41 kg or greater, see Table 4. Contraindications. Acetadote is contraindicated in patients with previous hypersensitivity reactions to acetylcysteine. Precautions. Serious anaphylactic reactions, including death in patients with asthma, have been reported in patients administered acetylcysteine intravenously. Acute flash and erythema of the skin may occur in patients receiving acetylcysteine intravenously. These reactions usually occur 30 to 60 minutes after initiating the infusion and often resolve spontaneously despite continued infusion of acetylcysteine. Patient information. Advise patients and caregivers that hypersensitivity reactions related to administration and infusion may occur during and after acetadote treatment, including hypertension, wheezing, shortness of breath, and bronchospasm. Side effects. Acetadote may cause serious side effects including hives, difficulty breathing, swelling of your face, lips, tongue, or throat, fever, itching, nausea, rash with or without a fever, reddening of the skin, especially around the ears, severe or ongoing vomiting, unusual tiredness and weakness,